We typically don't treat low-risk smoldering multiple myeloma, and let me explain why. As we always say, there's a huge spectrum of myeloma. At one end of the spectrum, there's MGUS, monoclonal gammopathy of undetermined significance, when people just have this little bit of a protein, but it's not damaging anything. At the other end of the spectrum is true active myeloma, where people absolutely need to be treated. In the middle is smoldering myeloma. And even within smoldering, we've made a division now to so-called high-risk smoldering myeloma, where we know that patients typically within about 2 years have a 50% chance of developing active myeloma, and then the lower risk smoldering myeloma, where patients have a lower risk of developing active myeloma in those 2 years or many more years. And one of the reasons why we don't treat typically low-risk smoldering myeloma is that a large percentage of those patients will actually never develop myeloma. So we don't want to expose them to treatment that may not be necessary until they've reached a point where their disease is getting closer to becoming active. That being said, there's a lot of research and work in the area better trying to understand how best we define low risk versus high risk smoldering multiple myeloma. So short answer, we're not treating it now, but we're trying to define it better to determine who needs that treatment.